Hello everyone, my name is Tom and I'd like to welcome you to ADO's October webinar. With October 20th designated as World Osteoporosis Day, we've put together this in-depth presentation which explores the causes, symptoms and treatments for this bone disease. Today's speaker is Clinical Assistant Professor from Georgetown University and ADO's Medical Director, Dr. Howard Zahalsky. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you again, Tom. So today we are going to talk a little bit about osteoporosis. Here's a nice picture of a great, strong person, and that's what you want out of your bones. You want your bones to be strong like steel. What happens in osteoporosis is that your bones get weaker. They're no longer strong like steel. But on the other hand, it's not like they're bendy and weak like, let's say, taffy. A great way to think of osteoporotic bones, bones with osteoporosis, is that they're kind of like styrofoam. They still have the same shape, the same structure. They're just a lot more breakable, and I want you to appreciate the difference here between breakable, crushable. So you can take a piece of styrofoam and snap it in half, but what's really easy to do is if you stand on top of it, you put a footprint into it, and then when you take your foot out, the footprint is left. That's different than, let's say, foam rubber, where if you push down on it, you're going to make an indentation, and you take your hand away, and there's no more indentation. With styrofoam, if you crush it a little bit, it stays crushed. And that's kind of like what your bones are when you have osteoporosis. Now, in order to understand how we get to osteoporosis, we have to understand where our bones start from. And let's see on the next slide. Here you have a nice, new, beautiful highway, probably just recently paved and lined. As you can see, it's long, it's firm, it's straight, and most importantly, it's smooth. This is how your bones are when you're born. They're nice and smooth, no dents, no nicks. They're all in great shape. But bones get beaten up. They get beaten up for a lot of reasons. Maybe you play football either as a kid or as an adult. Maybe you just fall down. Sometimes even just supporting your body causes your bones to just take some abuse, and we'll go on to the next slide now. So when your bones get beaten up, just like a road, even from normal wear and tear, this road didn't necessarily have to get hit by a mudslide, just normal tires driving over it. Tires are soft. Tires are made out of rubber and filled with air. They're like big rubber balloons. Yet years and years of constant driving over them, just like years and years of constant use of your bones, just causes them to get worn down. You get potholes in your bones. So what does your body do? Your body doesn't want potholed bones. Your body has to fix the bones. Your body and your bones are living organisms. So you need to fix your bones, and we'll go on to the next slide. We'll see how your body fixes your bones. It's really a simple task. It's kind of like fixing the potholes. What do the workers do when you have potholes? They fill them up. They fill them up with asphalt. But they don't just pour in the asphalt any more than your body just fills in the holes in your bones. What they have to do is, you've probably seen these workers on the side of the road with potholes, they get out the jackhammer. Why are they doing that? We have to carve away the damaged highway, the damaged asphalt, so you have a nice smooth area that you can pour in the fresh asphalt. Your bones are like that too. You have special cells that what they do is they carve away the damaged bone around the edges of the pothole, and then you have a different kind of cell which fills in the hole with new bone, or in the case of the picture, new asphalt. You can also think of it kind of like going to the dentist. When you get a cavity in your tooth, which is kind of a bone, what do? The dentist gets out his little drill and has to drill away at the decayed tooth until you get to the nice fresh tooth, and then you put in the filling. You don't just plop a filling on top of a rotting cavity. That wouldn't do anybody any good. Your bones are the same way. You have to carve out the injured, decaying bone, and you've got to put in the fresh bone. So I've used the word osteoporosis a lot, and I want to take an aside here to go over that there are two words in medicine that get frequently confused: osteoporosis and osteoarthritis. What is the difference between these two? Well, osteoporosis is exactly what we've been talking about: thinning of the bones. The bones become more brittle. On the other hand, osteoarthritis is specifically a joint problem. It makes your joints hurt. A lot of times they affect the same people. They both affect primarily senior citizens, especially older women, but osteoarthritis, which is also known as wear and tear arthritis, can certainly affect younger people as well. Osteoarthritis hurts. The joints hurt. When you move your knee or you move your hip or you walk too far, it hurts. On the other hand, osteoporosis, unless you actually get a bone fracture, doesn't hurt. So I have a lot of patients who come into my office and tell me, oh, yeah, I hurt all over from my osteoporosis. Well, it is true that they may have been told that they have osteoporosis, but that's not why they're hurting. Generally speaking, they're hurting from their osteoarthritis, and their osteoporosis is a separate problem that needs to be addressed. So just to further illustrate that point of the difference between the osteoarthritis and the osteoporosis, on the left, you have a thorn bush. A thorn bush can be very strong, but you don't want to reach in there, not because you don't want to damage it, but because it's going to hurt. On the other hand, the bones of osteoporosis are more like the dandelion, much more fragile, but you can hold that in your hand and wave it around and rub it up against your face with impunity because it's probably not going to hurt. All right, but back to the core of this talk, which is the osteoporosis. So we were talking about how in a normal, healthy person, even if your bones get beat up a little bit, your body repairs them. It carves out the decaying, injured bone and replaces it with nice, healthy bone. And in this picture, this guy's doing a pretty good job of maybe filling in some potholes with some asphalt. And it looks like the potholes that are being filled up nice and smooth. There's an even level with the rest of the road. Well, here's the problem with osteoporosis. As we get older, the fillers, the cells that fill up the potholes, they don't do as good a job. So what happens is you have a little divot or pothole of decaying injured bone, and then you have those cells come along that dig out an even bigger hole to get rid of all of the decaying, damaged bone. But then when the cells that are supposed to fill in that divot come, they don't fill it up all the way, and you're still left with maybe a smoother, less decayed pothole, but still a little pothole that remains nonetheless. Kind of like what you're left with is Swiss cheese, little holes in your bone, even after your body considers the bone to be fixed, that shouldn't be there. So what are the consequences of having extra little holes and more fragile dandelion-type bone? And we'll go on to the next slide. Here you have a little old woman who is a bit hunched over. This is one of the consequences of osteoporosis. Your spine is made up of bones, vertebrae, and they're kind of shaped like blocks. You can think of them as rectangular solids, if you will. Now, you put most of your weight on the front of them. So the weight isn't quite evenly distributed on the vertebrae because the vertebrae are in your back, and a lot of people carry extra weight on their front. There's a little bit more pressure on the front of those bones than there is on the back of those bones. Well, over time, if a person develops osteoporosis, remember we were talking about that the styrofoam doesn't necessarily have to break, it can get crushed. And you slowly, steadily crush the front of your vertebrae. Now, instead of having a pile of rectangular solids, one on top of the other, you have more triangular solids, prisms, if you will. Imagine you're playing with blocks and you're trying to pile rectangular blocks on top of one another. Pretty easy to do. But now imagine you're trying to do it with triangles. Well, if you can alternate them, that can work. You can turn two triangles into a rectangle sometime. But imagine all the triangles have to face the same direction. What's going to happen is that pile is going to quickly curve forward, just like the spine in this old woman whose spine clearly at the top of her back is curved so that now her neck is facing down while her lower back is still facing forward. That's a side effect of having osteoporosis and crushing the front of your vertebrae and curving your spine because of it. Now that's for the vertebrae type bones in your body. Obviously, there are other consequences of having more easily breakable bones. If you have more easily breakable bones in, for instance, your hip, you are much more likely to break your hip when you fall. And older people, for a variety of reasons, are at much higher risk of falling. Did you know that there is a 50% chance of dying in the 6 months after you break your hip? Why is that? Well, it's not just that surgery to fix your hip is very dangerous, because in some older people who need to go to hip surgery, it can be dangerous. But being immobile in bed and being on pain medicine for pain when you're in your late 70s or 80s, when a lot of people have hip fracture, can cause a lot of problems. It can lead to bed sores, can lead to pneumonia from being in hospitals and nursing homes. It can lead to what we call aspiration, where you choke on your own spit because you spend too much time lying back in bed. Because of all of these factors, if you fall and break your hip, even if you were otherwise completely healthy, there is a 50% chance that you will be dead in the next 6 months. That is a much higher percentage than many types of cancer, which illustrates just one of the reasons why osteoporosis is such a serious disease that we have to take so seriously, because it can be, if you break your hip, a potentially fatal disease. So what can we do to prevent osteoporosis? And we'll start to see the answer on the next slide. So here we have a carpenter. I want you to think of your bones as houses that your body has built. In your body, in order to build bones and repair bones properly, you need a carpenter. You need a director to say how to rebuild and to build in the first place your bones. But that carpenter can't do his job without wood and nails. If you have a carpenter standing around with no wood and no nails, he's not going to be able to build anything. So you need the carpenter, you need the wood, and you need the nails. The wood that makes up the backbone of your backbone is calcium. So you need to have enough calcium. Now, sometimes even in people with osteoporosis, it's possible to take too much calcium. So there has been new data recently in the last year or so, which says that you don't really need to overdo it with the calcium, but you do need a certain amount of calcium. The nails that hold everything together, so to speak, are the vitamin D. You do need to make sure you're getting plenty of vitamin D. Vitamin D is activated by the sun. So even if you eat a lot of vitamin D in your food, if you don't get a lot of sun, and a lot of senior citizens don't get enough sunlight, it won't be activated. Fortunately, the vitamin D that we give in supplements is already pre-activated. So taking a vitamin D supplement can be very useful for many people, especially if they're not getting enough sunlight to keep their bones healthy. Now, when women are younger, estrogen is the carpenter. Estrogen is what keeps the bones building properly and strong. Even though men's testosterone falls as they get older, it never falls to zero in most people, and they have enough testosterone to keep their bones strong, which is why men get much less osteoporosis than women. On the other hand, when women go through menopause, usually in their late 40s to late 50s, their estrogen disappears. And it's then that women really start to get osteoporosis, because even if you have enough calcium and enough vitamin D, your body doesn't repair its bones properly. And as I mentioned, it doesn't fill up those potholes as well as it should, leading to Swiss cheese bones. So that's how we can prevent osteoporosis in the first place. Certainly making sure we have enough calcium, making sure we have enough vitamin D, and in some cases, even replacing someone's estrogen as they get older. But sometimes that isn't enough. Sometimes, despite our best intentions, we develop osteoporosis, and our bones have reached that thin phase, and we're worried we're going to break our hip, or we're worried that our spines are going to start to curve. What can we do then? Let's go on to the next slide. There are several excellent medicines that we now use to treat osteoporosis in people who we discover have thin bones. We like to screen for osteoporosis, usually starting in your 50s, and every 2 to 3 years in people who we think might be at risk, looking for thinning of the bones and to see if the bone density, which is how we measure how thin bones are, gets too low. What Fosamax, and there are other medicines similar to Fosamax, which names like Actinel, and there's even some IV ones for people who can't swallow the pills with names like Reclast. How do these medicines work? Well, they're not perfect. What you would hope they do is fill up those potholes better. That's not actually how they act. The way they work is that when your body notices a pothole, it doesn't dig away as much of the injured, decaying bone. Would be kind of like, again, filling a cavity without drilling first. We found that it is better being here certainly a relative term, to put some new healthy asphalt on top of the old broken down asphalt, rather than dig away some of the decaying asphalt with a little bit of good asphalt and then improperly filling up the hole. It's better to have more bone than less bone, even if the more bone isn't purely healthy bone. By using these medicines, what we can do is slowly increase the bone density over years, because you're not taking away as much bone every time we fill a damaged part of bone. However, as I bet you can all appreciate at this point, if you just put good bone on top of bad bone, you're still not leading to some really strong, healthy bones. Those bones are going to be weaker than if they were just solidly healthy bones. You're getting in the way of your body's proper way of managing damaged, decaying bones. And because of that, what we've discovered is that if you're on these medicines for more than 5 years, you actually risk breaking certain bones in your body, the long bones, the thigh bones, your femurs, your upper arm bones, the longest, strongest bones in your body, because those bones, if they don't get properly fixed when they get damaged or decay, they're more likely to snap. So unfortunately, in trading off healing up your hips and making yourself less likely to have hip fractures, if you take these medicines for too long, you start to risk a higher rate of fractures in other places. So it can be a very careful balancing act in terms of maintaining good bone density in the places like your spine and your hip, while not giving you too much of the medicine or for too long, which can result in fractures in other places. But in order to maintain that, we've got to keep very careful attention on how much of the medicine we've given you, how long we've given it to you, and what your bone density was and is. So that's the basics of osteoporosis, what it is, how it affects you, how we treat it, and maybe even some of the limitations of how we are able to treat it because of side effects. On the next slide, we will see how Activ Doctors Online might be able to help you if you have osteoporosis. Activ Doctors Online has 3 revolutionary solutions. First, our personal health records put you in charge of your health. We help you to obtain and maintain all of your health records. This way, if you change doctors, if you change jobs, if you change cities, your doctors don't have all of your records, you do, which makes it a lot easier to go from place to place and doctor to doctor. Switching doctors doesn't mean that it's hard or you might lose your last several bone density tests and we're able to trend the bone density tests better. It means that we won't forget, or you won't forget, how long you have been on your Fosamax or reclass, so that we will know, is your 5 years coming up? Is it time for you to consider taking a break from your osteoporosis medicine so that we don't have to worry about you breaking some of your longer bones? These are things that if you change doctors can get lost in the morass of records as you try and go from one doctor to the other. Next, with our e-consultations, sometimes there are things like going over a bone density scan that don't need a whole trip to the doctor, especially if you do have osteoarthritis and your joints hurt, or you have had a broken bone and you have pain and it's hard to get out to the doctor. Maybe something as simple as going over a test result won't require a trip to the doctor, and you can do that trip virtually if both you and your doctor are members of the Activ Doctors Online community. Finally, with our second medical opinions, maybe you want to hear from a specialist whether these bone density medications, these medicines that can help with osteoporosis, are right for you given your unique set of circumstances. Through our second medical opinion program, we can put you in touch with one of our top specialists in bone or whatever your issue is from around the country and around the world to help you make sure that you're getting the best treatment. With that, I'm going to turn it over to Tom, who can tell you how to get started with Activ Doctors Online if this sounds like something that could benefit you.
Well, thank you, Dr. Zahalsky, for another great presentation. Here at Activ Doctors Online, our vision is to reinvent healthcare by providing user-friendly mobile health solutions that allow people all over the world to live healthier, safer, and more productive lives. We strive to educate, engage, and empower our members to take control of their health destiny to save time, money, and even their lives. We hope you enjoyed today's presentation, and we invite you to start a free 30-day trial over at activdoctorsonline.com and by clicking Get Started. For more information, to schedule a demo, or if you have any other questions about our service, please feel free to contact Activ Doctors Online using the information on screen. Thank you for watching, and we look forward to seeing you next month for another informative health webinar.